Question 331. The nurse's first action upon discovery of an electrical fire should be which of the following? A. Disconnect the electrical power if it can be performed safely. B. Smother the source with an object such as a blanket. C. Saturate the source with water or other readily available liquid. D. Activate the fire alarm immediately. Answer A. Explanation. If it is safe to do so, the nurse should disconnect electrical devices from the power source. Smothering with a blanket is not indicated in an electrical fire and might serve to fuel the fire, just as water or other liquids might incite an explosion or flames. The fire alarm should be activated promptly, and this should be the next action after disconnecting the electrically powered equipment. Safety and infection control. Question 332. The three major sequential med-rational crises for females include A. Puberty, pregnancy, and menopause. B. Death of the spouse, menopause, and childbirth. C. Rape, divorce, and menarche. D. Dating, engagement, and separation. Answer A. Explanation. The three major sequential med-rational crises affecting females are puberty, pregnancy, and menopause. These are life events that have been studied by many researchers and are considered the major events in a woman's life. Puberty is the onset, menarche. Pregnancy is a turning point in one's life from which there is no return. Menopause is the cessation of menses. The nurse has the responsibility to assess, plan, implement appropriate concepts to facilitate effective functioning and enhance growth and development. Choices 2, 3, and 4 are not sequential med-rational crises. Psychosocial integrity. Question 333. A client and his family facing the end state of a terminal illness might be best served by A. A rehabilitation center, B. An extended care facility, C. Hospice, D. A crisis intervention center. Answer C. Explanation. Hospice has the belief that more humanized alternative care for dying clients is needed than is being provided in hospitals, which focus mostly on medical cures. No matter where the care is delivered, hospice provides a specialized, interdisciplinary team of healthcare professionals who work together to manage client care, health promotion, and maintenance. Question 334. The nurse suspects an elderly client has been the victim of abuse. The client denies abuse and declines assistance. The nurse's next action should be to A. Do nothing. The client has the right to refuse treatment. B. Report the incident to the police. C. Arrange an appointment with the client's next of kin. D. Educate the client about available services. Answer D. Explanation. Although clients do have the right to refuse treatment, the nurse should remain non-judgmental and inform the client of available services. Frequently, elders are not aware of existing programs. Psychosocial integrity. Question 335. Local anesthetics block the conduction of pain impulses to the spinal cord. Their duration of action A is always longer than general anesthesia. B is determined by the rate of diffusion and absorption of the site of administration. C is usually short, 10 minutes. D varies depending on the client's weight. Answer B. Explanation. Diffusion and absorption depend on the chemical properties of the anesthetic and other factors such as local pH and the blood flow. Duration might or might not be longer than general anesthesia. Duration can be short if the type of local anesthetic is a short-acting agent. Client weight is not a factor. Pharmacological therapies. Question 336. A client with a pleural drainage system to suction has gentle bubbling the water seal. What should the nurse do? A. Notify the physician. B. Clamp the chest tube. C. Replace the system. D. Document the finding. Answer D. Explanation. Gentle beer bubbling is the normal finding for a client who has a pleural drainage system to suction, so it simply needs to be documented. If the bubbling becomes vigorous, it could indicate a leak, which the nurse needs to investigate. The remaining choices are not necessary. Reduction of risk potential. Question 337. Hormonal agents are used to treat some cancers. For example is A. Thyroxine to treat thyroid cancer. B. ACT8 to treat adenocarcinoma. C. Estrogen antagonist to treat breast cancer. D. Glucagon to treat pancreatic carcinoma. Answer C. Explanation. Estrogen antagonists are used to treat estrogen hormone-dependent cancer, such as breast carcinoma. A well-known estrogen antagonist used in breast cancer therapy is tamoxifen. This drug, in combination with surgery and other chemotherapeutic drugs, reduces breast cancer recurrence by 30%. Estrogen antagonists can also be administered to prevent breast cancer in women who have a strong family history of the disease. Thyroxine is the natural thyroid hormone. It does not treat thyroid cancer. ACTH is an anterior pituitary hormone that stimulates the adrenal glands to release glucocorticoids. It does not treat adrenal cancer. Glucagon is a pancreatic alpha cell hormone that stimulates glycogenolysis and glucogenesis. It does not treat pancreatic cancer. Pharmacological therapies. Question 238. The school nurse is conducting health screenings on school children. During the screening, she identifies a child with the behavioral characteristics of attention deficit disorder. Which of the following behaviors is consistent with this disorder? A. Slow speech development. B. Overreaction to stimuli from the surroundings. C. Inability to carry on a conversation. D. Concreted thinking. Answer B. Explanation. Children with attention deficit disorder are easily distracted but are able to carry on a conversation. Concrete thinking is more indicative of age, and slow speech development has more to do with other learning disabilities, health promotion, and maintenance. Question 339. Acute hyphema is associated with what type of injury? A. Orthopedic. B. Eye. C. Insect sting or snake bite. D. Gynecological trauma. Answer B. Explanation. An acute hyphema occurs as a result of a blunt injury to the eye and is manifested by a half-moon appearance or a horizontal line across the globe when the client is upright due to blood collected in the anterior chamber. Safety and infection control. Question 340. Hearing screening of prematurely born infants is an effective means of identifying disease and is an example of A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Disability prevention. And to B, explanation. The three levels of prevention address disease and disability across all phases, from absence of disease and at risk for disease to preventing further impairment. Hearing impairment associated with prematurity cannot be prevented by screening, but identifying the infants with hearing loss might prevent sequelae and further impairment by allowing early intervention, safety, and infection control. Thank you for watching.